Yes, thank you, Loretta.
There you are.
Molly Duplechian is also here.
Oh, Molly's here. Okay, thanks.
Yeah.
Sorry.
So I will share my screen and I'll let Molly get us started.
All right. Hi, everybody. Thank you for having us. I am Molly Duplechian. I am the Deputy Director of Policy for the Department of Excise and Licenses. And as Loretta said, we are here to talk to you this morning about a package of legislation that we are bringing to City Council in a couple of weeks. And so I will let Erica run through the whole proposal, and I will just warn you, it's a lot of information because there is a lot of changes and it's just a big topic. Just wanted to kind of highlight and give you the high level picture. Our goal really, and I don't know, Erica, if you want to go ahead and go to maybe the third slide, I think I'll just do this one real quick and then I'll hand it over to you. Just wanted to kind of mention our overall goals and what we were trying to do with this package of legislation. And so it's a pretty big rewrite to the marijuana regulations and the marijuana code for Denver. And so when we took a look at this, it's something we've been working on for a couple of years, really. And so first of all, we just took a look at everything with an equity lens at the center of it all. But had a couple of other goals for implementation around making sure we were striking the right balance between providing opportunities to businesses and consumers while maintaining the strong protections that we've had in Denver around marijuana for both communities and neighborhoods as well as youth. And so those were all the different kind of things that we were working towards and the different priorities that we were trying to balance. And so I'll let Erica go through it all, and I'll say stick on for questions and to hear the discussion, and look forward to hearing your feedback.
All right. Thanks, Molly. As she mentioned, it's going to be a lot. So if you have questions, I can't see the chat while I'm presenting, but feel free to either put them in there and we'll get to them to the end, or like Loretta said, wait till the end. Raise your hand and we can, make sure we get some questions answered. So one of the first things to put out there is that this is going to be a package of 3 different bills. So they're meant to be read together. They're meant to be considered as a package. Certain things are in certain bills, but this chart here shows you which items and which topics are covered by each bill.
Sleep well.
The biggest one is the biggest
Did the
bill
smell of the muffins wake you up? Seriously? Yeah, that's a nice thing to wake up to, isn't it?
So the first bill is going to be an omnibus bill. It's going to have most of the information
I'm in an INC meeting
that we're making changes to. And I believe somebody's got their microphone on. If you wouldn't mind muting yourself.
Wait, no.
Thank you.
And hey, Erica, you might want to share your screen, like make it the full screen, because right now we can see like the presenter.
Oh, okay. Now let's see if I can do this. I did this the other day. Is that better, Molly? Okay, great. So as I mentioned, 3 bills. The first one is the Omnibus Bill, and it makes most of the changes, so most of them will be there. It will cover the topics of social equity. It will address existing licenses that you're familiar with, and it will also address the topic of marijuana delivery. The second and third bill are a little bit shorter. The second bill would be to enact what's called a marijuana hospitality program. So this is in line with the state's marijuana consumption program. We currently have a cannabis consumption program in Denver that was voted on by the voters. So the second bill would enact the state program with the state parameters, and then the third one would repeal that pilot program bill that was voted on by citizens. So we'll go through each of the bills and each of the topics in just a second. But first, I wanted to go over, if I can, there we go, how we got here, just a little bit of background, because I know we always get a lot of questions about any outreach we've done, or who we've talked to, who's asked for things, and how we got started. So I'll go through some of that background first. We've done a ton of outreach on marijuana topics, as you all can imagine, through various channels, and both local and nationwide. So we have held interjurisdictional meetings to talk about marijuana equity, marijuana regulation, both at our annual Marijuana Regulators Management Symposium. So we get together with regulators from across the country, either who are already regulating cannabis or who are looking to regulate cannabis. We've done interjurisdictional calls with them for several years now, just to keep each other up to speed on what the different states, what different cities are doing. We've also participated heavily in the State Marijuana Enforcement Division's rulemaking work groups. So anytime the legislature passes a new marijuana bill, if the state rulemaking authority needs to make those rules, we participate in those open meetings and provide feedback about what's operational from a city perspective. We've also participated in local discussions with marijuana equity groups like the Black Cannabis Equity Initiative, the Color Cannabis, and the Denver branch of the NAACP. In 2019, we held some informal community sessions with a group called the Cannabis Community Equity Committee to get some initial feedback on what other jurisdictions were doing, which ideas sounded feasible for Denver, and to get just some initial thoughts. In the past couple of years, we've also met with dozens of interested citizens who just called or emailed us and said they wanted to talk about it. They wanted to share their thoughts. And so we've always been open and continue to be open to talking to anyone who's interested. In addition to that outreach, we've also done a lot of research, including with the help of our interjurisdictional partners, monitoring, analyzing, and comparing different equity programs in other cities and states, specifically in marijuana licensure. We've been following court cases and outcomes to try to, it's nice for once in Denver to not be the first jurisdiction doing this. And so it's been great to watch other jurisdictions try different things and see what works and what isn't working. In addition to that research, we also commissioned a marijuana business and employment opportunity study. That was something that we were interested in doing to inform our policy decisions with data. So we conducted that study in 2019, and it was released last year in 2020. It contained information garnered from informant interviews with business leaders, employees, owners, social justice advocates, city and state staff, related associations, and individuals. We also had 3 stakeholder sessions that had 35 participants, give or take each. And then we had 2 larger public forums where we talked about some broad ideas and got feedback, and each of those had about 100 participants. In addition, to get some of that data, we did an online survey that had 300 plus respondents. So if anyone is interested, I've linked that study. You can click on that link and it will take you to the study. I've also shared this slide deck with Loretta, so she will be able to get it out to anyone who's interested. After doing some of that outreach and research, we started working on legislative planning last year. So we convened what we call our marijuana licensing work group, and it had social equity experts, it had city and state agency representatives, we had elected officials, law enforcement, folks from the industry, folks from Smart Colorado, home delivery industry representatives, R&O members. So it was a pretty diverse group that gave us some really great feedback. We talked about delivery, hospitality, equity, other code changes broadly. And we, in our first 4 meetings, did a lot of question asking and folks were able to, make public comments either in response to those questions. They could bring up new topics, but all of them were, recorded and posted publicly on our website. Again, if you're interested in hearing any of that background discussion, those are all posted on our website. So using that input, we developed some high-level conceptual proposals. We brought that back to the work group after a couple of months of thinking through all of their suggestions and comments. And we used that input to start the next phase, which was the ordinance drafting. So we released the first draft of the ordinances on December 7th. We put those on our website as well. And then we had I think we've had 4 stakeholder feedback sessions in December and January. Those are open to anyone on Zoom, available to attend. And then we started also meeting with city council members to talk through the same ideas and proposals with them to get their thoughts. So this is where the letter from INC came in, and we were closing that window on feedback for
Christmas Eve, 1968.
Hello, I mean, if somebody is on,
Apollo 8 orbited.
okay, we're getting background noise. You need to mute. We're hearing something about Apollo 8, which is not our presentation. So maybe very interesting, but can you please mute? Thanks.
Thanks, Loretta. So we used a lot of the feedback. We got a lot of feedback on that first draft, a lot of useful feedback, and we've made some changes. And we just released those second drafts on February 10th. So those are all on our website. We have some slides that show the differences between that first draft and that second draft. If I know Christine is one who loves to dig into the nitty-gritty details. So if you're like her and you want to do that, those are all available. But this presentation today will kind of be a combination. It'll kind of go over what the proposal is as it stands today, so we can get your feedback. So we will continue to take written comments until March 2nd. And we will continue to take comments until we actually introduce the bill for consideration at City Council. The sooner we get it, the more time we can have to incorporate it. But once then it gets introduced at City Council, we can kind of go over what the next steps are at the end of the presentation. So with that, I will jump into the first bill, which is the Omnibus Bill. As I mentioned, it's got the most information in it. And so it does 4 key things that we'll talk about today. So the first is it's going to focus on equity. In the city, we talk about using an equity lens when we're making policy decisions. And so this bill really revises our marijuana code provisions using that equity lens and creating opportunities for certain social equity applicants. So we'll talk about that. The next thing it does is it tries to reduce bureaucratic red tape by aligning with the state laws, the state rules wherever possible. And then in a few situations where we think there are stronger local protections needed, we have added those, and those will be the areas where we'll differ from the state. So throughout the presentation, you'll see a little blue star. Those are areas where we are, enacting stronger local protections than the state has on the books. Another key thing that the bill does is that it reimagines how marijuana licenses would be distributed. So currently we have a system that caps the number of locations in the city for 2 types of licenses, and then requires a lottery system for distributing any available licenses. We want to reimagine how that looks and replace that with some licensing exclusivity periods for those social equity applicants. So we'll dig into that as well. Finally, in this bill, it authorizes marijuana delivery program, again with exclusive opportunities for social equity applicants. And the reason for this is to expand access for especially patients and homebound residents who have been asking us to do this for several years. So we'll talk about each of those in depth, starting with the proposed equity program. So I think the first question most of you would have is, what is a social equity applicant? Who would qualify? And then, once you qualify, what opportunities are available to you. So this slide here looks at who qualifies as a social equity applicant. We are looking at, again, aligning with the state. This is the definition that the state of Colorado has adopted for social equity applicants to access state benefits. And the first and foremost thing is that you have to be a Colorado resident. So it's only open to Colorado residents. If you're a Colorado resident, you can't have ever had a marijuana license revoked in the past. So if you were somebody who got a license early on and you weren't following the rules and your license was revoked, you don't qualify for this program. So if you're a resident who has never had their license revoked, you have to meet one of 3 social equity criteria outlined by the state. So the state has identified these criteria based on a lot of input from equity experts and social justice advocates, economics experts from the state to determine folks who may have had a disproportionate negative impact and barriers that they faced in entry to the marijuana industry. So those 3 qualifying criteria, you could meet any one of them. The first one is a residency location requirement. So if you lived within either an opportunity zone or a disproportionate impacted area for at least 15 years between 1980 and 2010, that's one way to qualify. And those 2 types of areas are defined by either the state Office of Economic Development or the state marijuana enforcement division. So if you want more information on areas that qualify, just let me know. Another way to qualify is whether the applicant themselves or their immediate family member, say a parent or sibling, was arrested, convicted, or suffered some sort of civil asset forfeiture due to a marijuana offense, ostensibly, from the war on drugs. The third way you could qualify is if your applicant, yourself, household, did not exceed 50% of the state median income measured by the number of people in your house. So again, that's a state formula. There's a chart. If you're interested, I can send it to you. So if you meet one of those criteria, you meet that third arrow there. So if you can check the box on all of those things, you may qualify as a social equity applicant. So what that means is that to gain licensure benefits through the programs, you would have to be applying to own at least 51% of the marijuana business license that you're applying for. In Denver, we'll get into this with our exclusivity periods, but that social equity applicant would have to remain a majority owner until 2027, or if they are not the majority owner, they would have to ensure that the license is held by a majority of social equity applicants who can meet these criteria. So applicants who meet the criteria would have a few opportunities in Denver. At the state level, being a social equity applicant qualifies you to participate in what they call an accelerator program. It looks like mentorship through an existing licensee. And so that's one opportunity that they have at the state. And in Denver, these are the opportunities that we would be looking at for equity applicants. So the first is a period of licensing exclusivity, where we would only distribute most of our license types to social equity applicants for a period of 6 years. So it would go through 2027. So any retail stores, transporters, cultivations, manufacturing, and the social consumption licenses that we'll talk about, which are called hospitality. All of those would be reserved only for social equity applicants for 6 years. In addition to that, the delivery program that we'll talk about that we would like to opt into, we would make that opportunity exclusive to social equity transporters, so that existing stores would have to contract with a new social equity applicant in order to conduct their deliveries for a period of 3 years. Finally, one of the biggest challenges that we hear and have heard from the social justice community is that barriers to entry are hard to overcome. And one of those barriers for folks who would meet social equity applicant criteria is the cost of entry. It is very expensive to start a marijuana business and to have that access to capital and to fundraising and to investors. And so one piece that we have included in the proposal is that we would waive application fees for our social equity applicants as a startup cost. And they would see a 50% reduction in their license fee. So that's the fee they pay annually for those stores, transporters, cultivations, and manufacturing. And then for the new license and permit types, that's the social consumption and delivery that would also be available exclusively to social equity applicants. Those would have a lower licensing fee than the existing licenses to ensure that it's an equitable entry point. And then one thing to note is that the bills also require our department to report to City Council. With those 6 and 3 year exclusivity periods, we would be required to report on that, provide data, and provide some sort of maybe recommendation on what would happen after those exclusivity periods expire, so that City Council can consider that before the program ends. Some other things that we wanted to mention, you might not see these in the bill language, but they're more programmatic opportunities for support that we would offer to social equity applicants. As I mentioned, that state accelerator program, our proposal allows for entry into the market through that state program. And then some things that we would be providing are process navigation, which we currently do for existing licenses, but would offer especially for social equity applicants who, this may be their first time navigating city processes, or it may be even a neighborhood looking to work with social equity applicants. So making sure that we're providing those resources for process navigation and education in the communities for the applicants and for the neighborhoods. Another thing that we are looking at that isn't in the bill, but that we're exploring is the opportunity for local grant or loan programs that could help social equity applicants access capital or be in touch with funding support that they may not have had the same access to as some of our early adopters. And that would look something like in the Office of Economic Development, similar loan and grant programs for small businesses that currently exist. So the next piece we'll talk about is kind of the basics of the new code, some changes that you will see in the language in addition to the equity provisions. So first and foremost, the big thing that you'll see is the bill is called a repeal and replace. So it will be all new language and it relocates. Currently we have a medical code that's in chapter 24 of the Denver Municipal Code, and we have retail provisions in chapter 6. This is similar to how the state did things at the very beginning. They had a medical code and a retail code, and the state has since moved to a combined code instead of repeating provisions for medical and retail, just outlining what applies to every license type and only pointing out where things may be different for medical or retail if necessary. So we are going to follow suit with that and relocate all of our marijuana provisions to be in one place, chapter 6. And you'll see that that is, I think will be more streamlined. Another thing that we're going to do is align with the state on terminology. So for example, the state refers to a location that sells marijuana, right, as either a retail store or a medical store. And originally we had referred to them as a retail marijuana store and a medical marijuana center. Some places were still calling themselves dispensaries from, prior to the legalization when we only had medical marijuana. So making sure that our bill is consistent with the state terminology, always calling them medical store or retail store so that everybody knows, what license and what business type those provisions are referring to. And then, as I mentioned, we looked through some of our existing provisions and practices and tried to evaluate them using an equity lens to revise them so that they could either, update or clarify the requirements and restrictions. So we'll see some of those. Now, you might be asking, what is an equity lens? What does that mean to evaluate policy? with an equity lens. So our Office of Racial Justice and Social Innovation, I think RSJI is what it's called. They have advised us, this is kind of the standard set of questions that when you're making decisions, and when we were making decisions in our office about each decision point, asking ourselves, who benefits from this decision? What are the associated burdens or unintentional impacts on any given demographic? What are the disparities that are addressed by the decision? And then how can we document our action steps so that we can correct any burden of unintentional impact connected to those key decisions? So these were the questions we were asking ourselves and continue to ask ourselves as we evaluate decision points. Do we go this route? Do we go that route? If we go this route, do we take, path A or path B? And so I'm sure a lot of you can appreciate that as you're making those tough decisions, that's not usually a question of right and wrong. It's right for which group versus right for which group, and balancing that with Denver values and goals. So that's what we mean when we say an equity lens. So some of the changes that are in the Omnibus Bill, you'll see the first is kind of that distribution mechanisms for how we distribute marijuana licenses. So currently, there is a mechanism that limits the number of locations that may be licensed. And then there's a prescribed method for how those licenses are given out or approved. Currently, the limiting mechanism is a cap on stores and cultivations. So locations where you can purchase marijuana or locations where you can grow marijuana. And then the method for distributing licenses under that cap is an annual lottery that's open to any applicant. And so when we were reviewing these mechanisms, we were noticing that they favored luck and they favored savviness, right? So people who had access to resources, who were had the historical advantage to be able to navigate these systems were the ones who were going to benefit. And so rather than have a system that does that, we're proposing a limit on the number of licenses using that social equity applicant exclusivity, not just for stores and grows, but for most of our licenses. And then rather than an annual lottery where even somebody who had everything lined up, who was ready to go, may not be able to get a license because there's a limited amount. The method for distributing licenses would be a year-round application period, but only for that limited applicant pool. So it wouldn't be open to everybody. It would only be open to those folks who may need, the year-round time to be able to get things like a lease in place or funding in place, and aren't being rushed to an annual event. We don't do that for any other of our license types. So it seemed like an unfair burden for this license type. There's some also neighborhood and youth protections in the bill that I definitely wanted to highlight today. So in the current marijuana code, there is a protection for no new stores, no new cultivations in the top 5 most saturated neighborhoods. So the 5 neighborhoods, statistical neighborhoods in Denver that had the most stores and the most cultivations couldn't get new stores or cultivations. We want to keep that protection in place, but we want to improve on it just a bit in the proposal. So for example, if there is a tie for 2 neighborhoods that are both in the 5th place, they would both be protected. So that's clarified in the proposal. And then not just new stores and cultivations, but what we noticed is that, people can transfer their location, they can move their storefront or their grow. And so any transfers would also be prohibited into those saturated neighborhoods. So it's not just new applicants who would be prohibited from opening, it would also be transferred locations. Another feature is that needs and desires hearing. That's again something that we want to keep and improve on. Currently the code only allows for in-person hearings, but with our hearing policies and procedures, this is something that you won't see in the bill language, but that would be part of the overall proposal that we would address through a programmatic and is to allow for the continuation of the virtual hearings that we've been testing out through COVID. So if you have feedback on how those virtual hearings have gone or have been going, please, please, please feel free to reach out. There's no deadline on this. We are always taking feedback. We actually just took some feedback from, I think, Brune, B-R-U-N, RNO to improve the opportunity for folks to object at the end of the hearing. So those are suggestions we're always open to. There is no deadline for that continuous improvement, but ensuring that virtual hearings can be an option moving forward and not just temporarily. The other piece that would improve the hearing process is, I think a lot of you might be familiar with the community engagement plan that's required from marijuana applicants. We are looking to improve that into what we're calling a social impact plan. It would cover more topics, and it would be something that would hopefully be a better tool that RNOs could use when they show up at that hearing. So a couple of ways that will happen: it would be required for all licensees, and it would be sent with the hearing notification packet. So the email that the RNOs get currently, that social impact plan would be in there. And we're going to provide a template for our applicants so that all of those plans would look the same. You won't have to navigate different formats from different applicants trying to find the same information. It would all be set up in the same way, much like your utility bill comes in the same format every single month. So you know exactly where to look for, the different things you need to check. In addition to the engagement with the local neighborhoods, these social impact plans would also require applicants to talk about any practices they have for diversity and inclusion in hiring and employment, as well as environmental sustainability, things that we know neighborhoods care about. And then they would have to provide specific metrics that they're using to measure the success of those goals, so that, it can't be vague, it can't be fluffy. It would be something that actually means something to the neighborhood, that they can read and say, oh, that makes sense to me. Those would have to be posted publicly for folks to access. And every year upon renewal, the applicants would have to update that plan and report out on the goals, how they did on their self-described goals from the year prior. So if they said they were going to do X, Y, Z, whatever it is, using whatever metrics, they would have to report out on that so the neighborhood could see, oh, this is somebody who did what they said they were going to do, which I think that's a feature that a lot of our marijuana licensees don't get recognized for, that they do often meet those goals that they set for themselves. And so, making that information more accessible and more available will help decisions being made in hearings, whether it's a new hearing or whether it's a renewal hearing. And finally, youth protections. These are a feature that our directors, very strongly on that. Advertising, location, zoning, and proximity restrictions. A lot of those are in place to protect youth and to ensure that we don't see a negative impact on youth perceptions about marijuana and youth usage of marijuana. So a lot of those will either remain or be strengthened. So we'll go over those. Here's kind of what I talked about with the social impact plan and the streamlining of virtual hearings. Another thing that you'll see in the bill is in the renewal hearing standards. The first bill listed a few things that we wanted to be specific about, but in the updated bill, we have made the language more inclusive of all of the different opportunities and all of the different circumstances under which the director may set a renewal hearing. So if you're interested in what all of those are, this is something that we would definitely do some RNO education and outreach about, to be able to know, when can I request a renewal hearing, under what circumstances, what types of, what are the standards for the director either denying or approving that renewal of an existing licensee. So that's something that we'll be working on. And if you're interested in weighing in on or providing feedback, feel free to reach out to us, and I would definitely love your input. Here are those youth protection regulations in a little more detail. So we are going to maintain our current advertising restrictions, and see that star there, that's somewhere that we're going to diverge from the state, who has created this expansion on branding that we're not going to be opting into, except for in a few circumstances for consumer goods and apparel. So we thought that was a good balance without allowing the outdoor advertising on billboards and things like that that we have not permitted to date. When it comes to density, the kind of how clustered the locations are to each other, we're going to maintain our prohibition, like I mentioned, on new store or cultivation locations or those transferred into those 5 most saturated neighborhoods. We're going to maintain the director's ability to consider density of outlets when she's issuing or denying a license, and then maintaining a 1,000-foot buffer between stores so that they don't cluster, because we know that has an effect on youth perceptions and usage. Proximity is a little bit different than density. It's to measure the how close a particular store or location is to other types of things, not necessarily other marijuana locations. So we're going to maintain our proximity restrictions for all of our license types, all the marijuana license types. These are pretty strong when compared with either tobacco or alcohol. So we have a chart at the end that I'll put up. But we are going to adjust the way that we measure proximity for certain things like drug and alcohol treatment facilities, city recreation centers, and outdoor pools. And the reason for this is to just align with the intent of the proximity restrictions and create a more fair, equitable way of measuring. So rather than measuring to the edge of the property that's listed for that use, we'll be measuring to the building, which is on par for how we measure the other protected uses. And what it does is it ensures that, you know, for example, a city recreation center in a dense area of town has the same protections as a city recreation center in a less dense area of town. So we think that will be a fairer way to measure. Other changes that you'll see to the omnibus are hours of operation for stores. We will be aligning with the state, allowing them to operate from 8 a.m. to midnight. We are adding some safety requirements though. One of those is a requirement for stores to secure any product in a safe or vault overnight to deter burglaries and ensure that if a burglary does occur, that, you know, a burglar would make off with less product that may be diverted to the black market or to youth or, you know, to places that we don't want to see it go if that does occur. Another safety requirement that is in the updated bill draft is to prohibit drive up, walk up, curbside delivery services that are currently allowed for by state rule due to the emergency rule. And these were put in place to allow, obviously, some options for social distancing during COVID-19 in order to ensure that, you know, people had different options and they didn't have to go into, say, small stores. But when the state rule, being clear that when these state emergency rules expire, that those things would no longer be permitted. And then you'll see this is, you know, more administrative, but increasing some of our fees for transfer of locations, modification of premises, and transfer of ownerships. These are things that applicants and licensees have to apply for before they do. They have to be approved by the department. And so just making sure that we're covering our costs for the work that we do processing those applications. So the last piece of the Omnibus Bill, as I mentioned, it's a long bill, is the delivery program. So it would propose that we opt in to a program to allow marijuana delivery. So some of the basics, because this would be totally new, this was approved by the state in 2019. They have a pretty strict set of laws and rules. If you're interested in reading those state rules and laws, you know, I can certainly send those to you. And these are things that would be features that, you know, either are incorporated by state law or that we would add, again, for stronger local protections. So a customer or patient has to be 21 or older to receive deliveries. And in Denver, we've added a requirement in our proposal that delivery drivers would be required to use an ID scanner to verify the customer's age before they hand them that product. Deliveries could occur in the same time frame that the state allows, between 8 a.m. and midnight. This aligns with the store hours of operations, so it's standard across the board. And then the limits on product that can be delivered are either, depending on medical or retail, set by state for both flower or concentrate or edible products. A big question that I'm sure a lot of you are curious about: where can marijuana delivery occur? Where is it prohibited? So marijuana delivery is open to private residences in Denver, or a private residence in, a city or county outside of Denver, only if that city or county has affirmatively voted to allow marijuana delivery. So if a city hasn't affirmatively opted in, they can't receive deliveries. So within the city, there's quite a long list of places that delivery is prohibited. So any premises located either at a school or on the campus of an institute of higher education, so colleges and universities, any premises on those is prohibited. Any premises on public property, and then any commercial property like offices or retail space. And then the state also has a provision that deliveries cannot be made to a consumer or a private residence where that delivery person knows or reasonably should know that that consumer or private residence has already received a delivery during that same business day. So that's to prevent people from getting around those product limits. Those are all set by state. And then additionally in Denver, we're also going to add to that list that our proposal also prohibits delivery to a drug or alcohol treatment facility for obvious reasons. So some of the safety regulations for the drivers, this is a question we get a lot of concern about, the drivers and the communities they'll be in. The state requires video surveillance to record the marijuana storage compartment within the vehicle, as well as the front view of the vehicle. And that footage has to be retained for a minimum of 40 days. So if anything were to happen, there's video footage and surveillance required. There's also limits on the total amount of product that any one vehicle can have in it at any given time. They have different limits for enclosed vehicles versus non-enclosed vehicles. The enclosed vehicles in Denver, we want to make it stricter than the state. The state allows up to $10,000 worth of retail value of marijuana to be in the car or in the vehicle. But in Denver, we would half that. So it would not be able to contain more than $5,000. And then non-enclosed vehicles would align with the state. They could not contain more than $2,000. So those are the limits. Additionally, we are requiring delivery drivers to keep their records and receipts in the vehicle so that, if they are stopped by an enforcement officer, that enforcement officer could clearly see records to determine if anything nefarious is going on. Now, when it comes to getting a delivery permit as part of our licensing program, only two types of licenses could apply to get this permit. So either a medical or retail marijuana store, so a brick and mortar storefront, or a medical or retail marijuana transporter. So a transporter is an individual license that's non-transferable, that would, allow some opportunity for somebody who didn't have maybe the resources to, establish an entire brick and mortar to be able to engage in this. So this is that exclusivity piece that I mentioned earlier, and it's a bit nuanced. So if you don't get it right away, that's okay. Feel free to ask me questions. I live and breathe this every day, so I get it. It's kind of confusing if you're not. So for a period of 3 years, only transporters would be able to conduct deliveries in Denver. So the transporters would have to qualify as a social equity applicant, that criteria we went over earlier, and then they would have to obtain a delivery permit to be able to, get the vehicles and drive that product from the store to the customer. Now, stores that would supply the marijuana through the transporters would also have to get a delivery permit, but they would not be able to conduct deliveries on their own behalf until 2024. So that's something different in Denver's proposal. And that would be, the reason behind this is to give social equity applicants, rather than existing licensed stores who were more than likely an early adopter, the opportunity to create a name for themselves in this space, providing patient access and things like that. The permit fees, if anyone's interested, the application fee would be $500, waived for social equity applicants. The license fee annually would be $2,000, and it would cost $1,000 to apply. For example, if a store had a delivery permit and they wanted to move, they would have to transfer that location. That would be $1,000. And if they wanted to transfer ownership, it would be $250. So we have made it through the very long first bill, and the other two will fly, and then I promise I will get to questions. So the next piece of the proposal is a hospitality bill for social consumption. So it would align with the marijuana state code again to create a hospitality program that allows for lawful marijuana consumption establishments. And these would have smoking and vaping options, which our current proposal does not have. One piece of this that our director felt very strongly about is that in shifting from our existing framework to the state framework, we wanted to continue to protect youth and make sure that we were thoughtful about how we made this shift. So just for some information, there's two different license types when it comes to social consumption that the state authorized. And there's 3 different models for how that could look. So the first license type is a hospitality establishment. That's a location where it's bring your own only, and there's no sales permitted at that location. And there's 2 different ways that could look. It could be brick and mortar with a permanent licensed premises, like that darker green, or it could be a mobile licensed premises on that lighter green. But both of those would be bring your own only, no sales. And we have one existing license that would fit into the dark green category, and we have a couple of operators who would likely fit into the light green category. The yellow category on the right is a different type of license. That's a hospitality and sales. So that can't be mobile, it has to be permanent. And it would allow for limited sales, single servings ish, and you could not bring your own, and there are some extra restrictions. So we'll kind of go through what that means, but these are all authorized by the state. So some big questions, who could enter these establishments, and patrons have to be 21 or older, no matter the type of hospitality establishment. The operating hours for these are similar to, on-premise consumption for alcohol, so 7 a.m. to 2 a.m. And then the methods of consumption, this is the key change, is that the state would allow us to opt into an exemption from the Colorado Clean Indoor Air Act to allow for indoor smoking and vaping, as long as there are proper odor and ventilation controls in place to prevent odor and ventilation from becoming from becoming a nuisance. So those are the state restrictions. These are some additional requirements that we would enact in Denver in our proposal. So one is regarding overlapping premises. So this is kind of a technical restriction, but all types of hospitality establishments would be prohibited from overlapping with either a medical or retail marijuana store. They would have to be separate from that store, especially if they're going to have sales, so that, that way they're separate locations, separate doors, things like that. As far as odor control, an odor control plan would be required for all types of hospitality establishments, again, to ensure that the odor is not a nuisance to the surrounding neighborhood. And then all applicants for a hospitality license would have to undergo a needs and desires hearing, just like a liquor license or an existing marijuana store license. unless the hospitality establishment is mobile, because they wouldn't be a permanent fixture in any particular neighborhood. However, they would all have to provide evidence of community support at the time of application. This is a feature of the existing I-300 where we only have one licensee, and it's a feature that we've borrowed for other license types as well. For the site requirements, the state does allow for indoor or outdoor consumption, but if it's outdoor, it has to be surrounded by a wall, a fence, a hedge, something that is site obscuring to the general public. And also in Denver, of course, if there is going to be proposed outdoor consumption, they would have to comply with that Denver odor control plan, again, to ensure that it's not a nuisance. Another feature is that these hospitality establishments are allowed to be co-located with what's called an RFE, a retail food establishment, so a restaurant. But it would have to be separated from the rest of the restaurant, again, by something that's site obscuring, a barrier, a secure door, and marijuana would not be allowed to be added to the food that is served in that retail food establishment. So it would have to be a specialty restaurant. So some restaurants have a liquor license so that they could serve beer and things like that. It would be similar, but with some added restrictions due to the effect of smoke. Again, the odor and ventilation plans still apply. So here are those proximity restrictions that I mentioned, especially for the consumption use. You'll see what we're proposing is in that first column with bolded. It would be the same as the proximity restrictions that are in place for the pilot program, 1,000 feet from schools, childcare facilities, city pools and rec centers, alcohol and drug treatment facilities, and then also adding a buffer from other hospitality establishments to get away from that clustering for its effect on youth perceptions. And as I mentioned earlier, this is stricter than what currently is in place for alcohol, tobacco, or bars as it exists. Those are set typically by state. A couple other specifics for mobile hospitality. If there is going to be a mobile premises, it would have to have GPS tracking per the state. It would have to submit its route and log that route with the department. And then in Denver, it would also not be permitted for that mobile vehicle to have any external markings, words, or symbols that would, kind of constitute advertising of marijuana or marijuana consumption. And then the applicant would have to provide that route information if it's stopped and allowing consumption for any time more than 30 minutes. For hospitality and sales, that, as I mentioned, the sales limits would be much less than what a store is allowed to sell. And as you can see, it would be limited to 2 grams of marijuana, 0.5 gram of marijuana concentrate, or products containing 20 milligrams of THC or less. Those are all set by state. These are the fees that would be associated with that license type. So $1,000 one-time application fee, unless you're a social equity applicant, annual $2,000 fee, and then $1,500, $250, and $300 for any of those transfer of location or ownership or modifying the premise. Finally, the last bill is short and sweet. It would repeal the existing citizen-initiated ordinance, because if the second bill passes, these provisions would be defunct. So it would only be considered after the hospitality bill, if that is passed, and it would convert the existing DCA licenses into hospitality licenses. So just, aligning them with that state framework. And then they would have to, excuse me, lost my sound there. The DCA licenses who are converted will be required either to have that permanent premises or mobile vehicle premises in line with state law. So that is a ton of information. I know you've all been patiently waiting to ask questions. Before we get to that, just a couple of next steps so that you're aware of what your options are when it comes to weighing in. So this is the typical city council process, just to give you all some insight. As I mentioned, we will be taking feedback on the bill at the agency level until March 2nd, which is when we have to submit the bill draft for consideration. That is when we are presenting at the City Council Finance and Governance Committee. That is a public meeting. There's time at the end for public comment. After that public comment, the members of that committee vote on whether that bill goes to the full City Council. There's a formal step where that, any bill that's passed out of committee gets read for the mayor and council, and then the bill's considered by the full council at first reading and voted on at second reading. So that's kind of the general process. So there's opportunities to provide your feedback to us up until March 2nd. That date is subject to change if, for example, the finance committee says, hey, we've got something else to consider, you have to come later, but it won't be any sooner than that. And after that, then any feedback would be through the public legislative process with your city council members. There are a couple of other options if you want to learn more. We're having another stakeholder feedback session for the general public next Wednesday from 5 to 7. I've added a little Zoom link there. It's also on our website. That presentation will be a pretty deep dive into the nitty-gritty changes from the first draft to the second draft for anyone who's following along. But there's also time for feedback at the end. If you're somebody who likes to write rather than speak, you can certainly send any written comments to us at marijuanainfo@denvergov.org. We made a template if that is easier for you, but we will consider any comment that we get. And as I mentioned, we'll consider those comments until we introduce the bill, but the sooner it's received, the more time we can have to consider. If you want to request an individual meeting just to learn more or ask questions, I know I've done this with several RNOs or individual RNO members. That's how you can reach us at marijuanainfo@denvergov.org, or you can sign up for our bulletin if you're not already subscribed. We always send out notifications of meetings, legislative actions, work groups, things like that. If you're really interested in marijuana, definitely make sure that you're signed up for that. So at this point, I will stop sharing my screen, and Loretta, however you want to divvy up the questions, just let me know.
Okay, I know, and Molly, thank you so much. And Erica, thanks for presenting. Molly, thanks for answering some questions. I know, let me go by in list of who has asked questions. I'm not going to go through the questions because some of them may have been answered throughout the process, but I want to make sure that we go there. Miles, I'm going to start with you. You were the first one with a couple of questions. Some of yours might have been answered, but why don't you go ahead and let's start with you.
Thank you. It's interesting. I guess I just have a quick comment. I wish maybe we had been more involved earlier in this process. Again, I'll just talk about my experience with the process, that the city basically talks to some people, does a little bit of outreach and comes up with a bill and then presents it. And then we just have this small window to actually understand what's being presented. And lately, the city has been bundling all of these things together, and it makes it incomprehensible to understand what's being proposed. And I can understand a lot of what's happening here, and I can see where they're getting at. But some of the questions I have were, so the reasoning for this, it sounds like to allow more opportunities for people to use and access marijuana. And is this coming from a need from residents, or is this coming from retail sites wanting to be able to sell it to people visiting and to create greater opportunities for them to do that? So it's kind of, what is the genesis of this? And I understand it's under the equity piece, and I think that's more of a code word, and you can pass anything with saying, oh, it's going to be equitable. But it also sounds like you're also going to remove the caps on these businesses, and you're going to say you can only expand it into these other neighborhoods that don't have it. So it sounds like you're basically saying caps are removed. If you operate in one of these other neighborhoods, you can then increase and have more retail and do these things. That's basically my comment. Thank you.
So there's a couple of different pieces in there, and I'll try to get them all, but if I forget one, I'll just have you remind me. But we got a lot of feedback, and the state got a lot of feedback that led to the adoption of these license types in 2019. Advocates in Denver and statewide wanted opportunities for marijuana delivery and social consumption. Now, social consumption is something that the Denver voters already approved in 2016, I believe. So we've had that license type, and this is just conforming with the rules and guidelines by state for what opportunities are available, so that it's less confusing. So that's the piece about social consumption has already been voted on by the voters, and we're trying to remain in that intent. What we have heard from communities and concerned citizens, and I know you'll hear from Henny Lasley as well, is that people want there to be designated spaces for folks who are going to be doing this to go do it, so that it's not out in public, it's not out in the open, it's not exposing youth. So that was a big reason for maintaining that opportunity that the voters had asked for. When it comes to delivery, we've heard a lot of patient advocates asking for options, saying that I can get my prescription drugs delivered, people can get alcohol delivered, people can get pretty much anything delivered now that we're in COVID. Why is this the one thing that if I have seizures, I still have to find somebody to take me to a store to access the product? Why can't I get this delivered, like my arthritis medication or, the cocktail that I want to make later? So that was a piece that we considered heavily as well, how to make that opportunity available for folks without expanding the framework too much. So I hope that answers your first question. Now I've forgotten your second question.
It sounds like the licensing is removing the store caps and then is basically pushing new development into all the other neighborhoods for new licenses.
So the caps would be removed as the mechanism for, kind of limiting the amount of locations. However, as many city council members have discussed on different, taking different positions, there are other limits that still remain in place, such as the proximity restrictions, zoning restrictions, and prohibited uses of land. So there's, it's not, I don't think, going to push, it's not going to open up a floodgate, so to speak, of business development into other areas of the city. It is going to make a few additional locations available for those folks who are the social equity applicants, rather than any applicant who would be able to get a license through the lottery.
And just a quick follow-up question, and I've seen this in a lot of the city plans when it's presented.
Miles, I want to make sure that other people have the opportunity, and we can come back to you on your next question. But why don't we go ahead and I'm sorry about that. I put it in the chat and I hope you all saw that, but I want to go back to our presenters and make sure that the other people have the opportunity. And so then we'll get back to questions for everything, because that may help too. So the next person is presenting is from Smart Colorado. So please stay on the line, Erica and Molly, if you can. Henny Lasley, are you here?
I'm here.
Okay, great. I don't know if you have something you want to share, but why don't you go ahead?
Sure. Good morning, everyone. I think, could the host please allow me to share my screen?
You should be able to share.
Thank you. Good morning on this cold February morning. My name is Henny Lasley. I'm one of the co-founders and executive director of a organization called Smart Colorado. We are in the process of transitioning our organization to be called One Chance to Grow Up. It's actually an initiative of Smart Colorado because our mission is to focus on protections for youth since marijuana has been legalized and commercialized. So you'll see us talk a little bit about One Chance, and sometimes we call ourselves Smart Colorado. So we're just in a transition period. So just really quickly who we are and why we do what we do. After the voters passed Amendment 64 in 2012, allowing for adult use, a task force came together by then Governor Hickenlooper. And at the time, when the task force that came together was looking at the implementation of the regulations, there was a concern from many parents that the impact on kids was really ranked last in terms of the priority for when it was time for the regulations to be put in place. And that was concerning because Colorado was the first to have ever done this. So we felt like there needed to be an organized effort to make sure that kids were in the conversation. We're a nonpartisan, nonprofit, Denver-based organization. We do not receive or apply for any marijuana tax revenues or accept money from the marijuana industry. We stand for kids and advocate for regulations that to protect them. We are not a repeal organization. We are not trying to undo the will of the voters. We're trying to make sure that there's education and information about impacts and potential public health and safety that we need to consider as a city and a state. So many of us have, just really quickly about us, many of us have kids or family members that have been impacted by marijuana use. We spend a lot of time educating citizens and policymakers about there's such a wide difference now between CBD and THC and products derived from hemp and what's actually out in the marketplace today and sold in our dispensaries every day. So a lot of what we do is education for policymakers, education for parents and trusted adults to make sure that it's known that the marijuana that many adults might have used as someone in the 60s or 70s or 80s is a much different product than it is today from a potency standpoint, but also methods of intake. And I'm really not going to focus on that because what we're here to talk about is hospitality and delivery. Again, because we were the first, it just made for a wide gap in misperceptions and huge gaps of information. So again, just a little visual to show all the differences between products of today. So this map I show you because there was a lot of discussion, and Erica, thank you so much for your presentation. Just to show again, just where, and it's a difficult slide to see on a Zoom call, but this does show where we have high concentrations of licenses, and then it's overlapped by what are concerning statistics and indicators by the city with respect to the well child being indexed. So the areas of darker blue unfortunately have a very high concentration, and we're really pleased to see that there's consideration to not continuing to oversaturate these particular neighborhoods. So just really quickly on Colorado youth and Denver youth, the numbers are pretty much in line with one another, but the big takeaways really for this morning is that while 20% of Colorado youth do use marijuana and reported it in the last 30 days, according to the Healthy Kids Colorado survey, about 50% of them are using high potent products, and that includes dabbing. And those are products that are sold every day in our dispensaries. And that's concerning to us because of the fact that we were promised that marijuana and marijuana products would be kept out of the hands of kids, and that's quite frankly not happening. Also, just one other thing concerning from a citizen and community standpoint is that high schoolers are now reporting that they're twice as likely to drive high than they are driving after alcohol. So you can see that we have a very large education process ahead of us with respect to our kids, because there's just this perception that it's safer to drive high. And I know Truman's going to talk, and he also could probably identify that that continues to be a problem in the adult space as well. So this is just a visual to show the different ways now that kids use marijuana. The top line shows that there's a tendency towards more of the high potent products that are sold in dispensaries, including vaped products, edible products, and there's a decline in the number of kids that are what we would just call smoking weed. So it's trending to how adults are using it and being able to purchase it on the commercial market. So to the conversation at hand, full disclosure, Smart Colorado in 2019 opposed the bill that would allow for municipalities to opt in to social consumption or hospitality. We did that because we're concerned, even though the data is not there for marijuana, it's pretty apparent that the more commercialization that is allowed with other substances, that it begins to normalize the behavior and lessens the perception of harm in the eyes of kids. And we've seen that with tobacco and alcohol. But I really do want to commend the city of Denver and Ashley Kilroy and her staff, Molly Duplechian and her tremendous team, along with Erica in Excise and License, to try to really strike the balance of protecting Denver youth from whatever impacts might actually occur. So we really want to commend that there's still going to be a distance requirement from where kids congregate, like schools and outdoor city pools. We also really appreciate that the city is deciding not to opt into billboard advertising that is allowed by the state. So those are protections that are really important from a public health standpoint. There's a few other things that we'd like to see City Council consider. We'd like to see City Council consider holding the dispensary hours of operations to 10. We all worked really hard 3 years ago to make sure that that happened. We are concerned just from a safety standpoint about marijuana edibles being allowed because of the delayed impairment reaction that can happen with edibles. That's very soundly supported by science from the State Health Department. Again, I've heard some conversations about outlet density and the licenses for dispensaries being lifted. There are concerns about that, of course, because of proximity and density and the impacts on youth. And so that's really our big things on hospitality. On marijuana delivery, Smart Colorado went neutral on that bill in 2019. The reason being is because the proponents, when it was brought in 2019, agreed from the get-go that there should be no delivery to the under 21 market. And so that was why we went neutral on that bill. So our comments really about delivery, again, because it hasn't been done in Colorado, is that we worry a little bit about multiple delivery services delivering to one particular location, creating the opportunity for a black market sales opportunity for youth. And some of the other things we've listed here are really more for the public health and safety side, and really more in the wheelhouse of the Denver Police Department and things like that. So that's really the extent of my presentation. I'm happy to answer any questions. If you'd like to keep up with what we're doing, feel free to sign up for a free newsletter, free information on our website just about the impacts on kids. And with that, I'll stop my screen share and say hello.
All right, thank you. Thank you very much. All right, the next presenter we have is Truman Bradley from the Marijuana Industry Group. Truman, are you there? And you should be able to share your screen.
Hi, Loretta, thank you. This
Hi.
is Truman from the Marijuana Industry Group. I'm gonna try to share my screen here. Are you guys able to see the
Yes.
overview of licensed cannabis in Colorado? Okay, great.
Yeah.
I'm not going to go through all of these slides, but just as a brief background, the Marijuana Industry Group was founded in 2010 to represent the licensed business community for Colorado cannabis licensees. We've since expanded to include ancillary companies, support companies, staffing companies, payroll companies, those kinds of things. Basically, anybody that touches the plant or supports, any businesses that are in that space are eligible to be made members. We've presented it at numerous RNO meetings over the years. This will be our 11th year, and just want to say thank you for the opportunity. I used to own a couple of marijuana businesses in the city of Denver and was invited to join the board of We Can for a couple of years. And then after I exited those companies and moved on, I stepped down from We Can because I no longer own the business there. But just want to give a shout out. So hi.
Hey, Truman, can you make that full screen when we go to the other slides?
Yeah, I'll do my best here.
Okay, thank you.
Let me see if I can do that. Sorry. Sorry, how do I do that?
Go down to the bottom, the gray band at the bottom of your screen, and over on the right-hand side, keep going, right there. Whoops, back. Nope, back.
No, this.
Right there, yeah.
Bingo. Okay, great. So very quickly, medical marijuana was legalized in Colorado in 2000. In 2013, Colorado became the first state to legalize adult use cannabis. At the time, more people voted in Colorado to legalize adult use cannabis than had voted for any presidential candidate ever, all the way up through and including Obama. I haven't actually run the data for the most recent two, so in my copious spare time, I will do that. I'm going to jump around a little bit. There is medical and adult use cannabis. Over the years, these two programs have sort of come together in their, in the types of laws that affect them. A couple of things I'll point out is that Colorado was the first to implement a regulatory oversight of cannabis of any state in the union. And so licensees are taxed and regulated, highly regulated by different departments, including the Marijuana Enforcement Division here in Denver, Excise and License, as well as interfacing with the rest of Denver's regulators, whether that's the building department, whether that's Denver Department of Health, et cetera. The Department of Ag oversees pesticide restrictions, and OSHA comes in and checks out the cannabis licensees. When I owned my dispensaries in Denver, I estimated that we were inspected about 20 times a year by various inspectors, and that's a good thing. As you guys hopefully know, there's a seed to sale tracking program that the state requires all licensees to use. It's called Metric. And that's really tracks it all the way from the plant through the sale. Here are some, here we go. Here are some of the things that all cannabis is tested for. This includes potency, microbials, any residual solvents that are used to make concentrates. With edibles and concentrates, there are tests for homogeneity to make sure that the products have the same amount of everything throughout the batch, if you could imagine like cookie dough or something like that. Everything is tested for pesticides as well as heavy metals. On the medical cannabis side, there can be youth that have medical cards that go see a doctor every year, but otherwise you have to be 21 or over on the adult use side. You cannot consume at the point of purchase in dispensaries, but obviously with the new social consumption rules that are being discussed in Denver, that would change. Moving along here, we are really big advocates for regulation because of the things you see on the left side that I've been talking about. We can track this really well. It's enforced by all the different agencies, and the penalties for non-compliance are really severe. Versus the non-licensed areas. And so that's just something that I think Colorado's done a really good job of, throughout this time. According to the Healthy Kids Survey, we haven't seen an increase in youth use since legalization happened. Quick look at what exists right now. The top line are stores, the middle line are grows, the next line are manufacturers of infused products, and then testing facilities. And I'm moving pretty quickly because some of this is old news. MIG has partnered with different agencies to really try to keep both youth and adults safe. And this is something that continues to be a high focus area for us. So we're working with CDOT on their latest impaired driving campaign. You know, we serve as the mouthpiece and the conduit to the licensees. And so if CDOT is pushing out a new initiative, we will work with the dispensaries and, once it's legal, the social consumption venues to make sure that they are communicating, you know, the most important and latest and greatest messaging that's out there. We have not seen an increase in crime with legalization. And so that's, I think, something that, you know, we're really proud of. The industry has currently a 97% compliance rate on state sting operations at the retail level, which is 29 times lower than that of alcohol here in Colorado, at least in 2019. And here's that number for you right here. This comes from the Marijuana Enforcement Division. As I said, teen use has remained flat. I'm moving pretty quickly because I want to get to the Denver stuff. Tax revenue for the industry is one of the higher areas for the state in terms of what they collect. So in 2020, the state collected $387 million. And then local governments receive a portion of that in addition to the city sales taxes that Denver imposes. This is a quick slide about how the state spends its money. It spends it on a number of different areas. I'll actually jump to the next one. Hopefully you guys can see this, but the state spends its money on public health and the environment, 20%, education, 16%, human services, 31%, and then it kind of goes on down from there. I jumped around a lot. When I think about the Denver ordinance, I really want to thank the city, Molly Duplechian, Erica, who is also on here, Ashley Kilroy and others for doing stakeholdering. What they're contemplating is pretty robust, and you know we're looking forward to continuing to work with them on the draft. We do support the extension of hours. We've seen in other places such as Aurora and Edgewater that really the wheels haven't come off the bus with longer hours. So we are supportive of that. But happy to answer any questions that you may have, and thank you for your time.